Good afternoon, everyone. My name is Amy Smollers, and I am Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Next Generation Data Security in Healthcare. A few logistics before we start. If you have questions, please use the chat feature today as we are in listen-only mode. We will be monitoring the chat throughout the presentation today, and we'll do our best to get and address your questions at the end. I also want to take a moment to thank MHA's 2023 sponsors for their support in underwriting today's webinar, which is just one of the many events that we offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm now pleased to introduce our speakers. Jefferson Dance is the Chief Innovation Officer at Eclypses. Jefferson brings over 15 years of leadership experience, and prior to joining Eclypses, he was a global and enterprise security architect, a security strategist, and has been an innovator and change agent. Marc Johnson is a senior advisor and CISO at Impact Advisors. Marc specializes in IT, governance, risk management, threat intelligence, analytics, and more. Thank you both so much for being here today, as we're really looking forward to this discussion, and I'll hand it over to Marc to get us started.
Excellent. Thank you so much. Let's go ahead and go to the next slide. We've gone through the introductions. Let's get into the meat of the matter. All right. So let's talk a little bit about those, the impact on margins. Go to the next slide, please. So when you think about healthcare in general, you think about what we've heard in the media, we don't want to call out anybody in particular, but it's prevalent. It's out there. As the cyber attacks continue to proliferate, we continue to try to take care of them, not only from a response perspective, but also a preventative perspective. Next slide. When we consider the fact that margins in healthcare are continuing to be pressured over and over again, we have to think about keys to success. How do we maintain what we've got? How do we continue to eliminate the outflow of cash when it comes down to protecting data, protecting ourselves? And more importantly, it gets into, what about making sure that we can physically keep operating and taking care of patients and so forth? So getting down to brass tacks, there's a lot of things that we can do to eliminate those costs associated. So for instance, cyber security insurance, those premiums are continuing to go up and escalate because of the ransoms being paid. So if we take the time to eliminate the need for paying ransoms, if we take the time to put controls and programs in place, then we can help the margin out and we can continue to move forward. JD, your thoughts? Next slide.
Oh, thanks, Marc. As we see these percentages, that are linked to these particular issues, they've been growing over the years, and they're starting to take up a significant part of the day and time in the business. As you can see, the average cost, that's an average cost. Some could be higher, some could be lower. But even before you get into the impact from regulatory, from HIPAA, from any kind of violation fine or a material impact to the business, you're already at $4.5 million. And that's not to say the biggest impact, which is delivering care and service to patients, which is, in the healthcare space, the most important. So, and, to hammer on that is all of these things are driven by data and the systems behind them that allow us to deliver service and care to our patients. And Marc, you can get into the cost a little bit more on the next slide.
Absolutely true. So it's not an if a breach is going to happen anymore, it's a when it's going to happen. And so when we consider the fact that it's generally not the technology that failed, it's generally the people that have either misconfigured or have brought something into the environment, we have to then take the step back and understand that to eliminate the cost of a breach, we need to respond internally as to how we protect our data. How do we protect the information from getting out of the organization? And that really, that's what the crux of the matter is that we have a thought process in general in the industry where we're always trying to protect the outside, always trying to make sure that, in fact, somebody can't get in. But when we consider the main fact that a bad actor has been in an environment for an average of 79 days, we have to take that next step and say, okay, what do we do when they do get in? Next slide, JD.
Thanks, Mark. So into referencing the intro, there's understanding the threat. It's, these attacks are consider them targeted attacks on healthcare, on the healthcare space and healthcare data. They're starting to find interesting patterns and things to weave in. They're starting to attack IoT, traditional IoT devices and IO medical technology, which are being delivered at sensor level. It could include patient data, vital statistics, things of that nature. And as more data is flowing to deliver patient care and to deliver the kind of almost on-demand services that a modern connected patient is expecting, we're seeing nearly 50% of those breaches include patient information. I'll put one caveat there. That could include PII, but that necessarily wouldn't be counted towards a healthcare breach. But, a lot of healthcare organizations also have a large amount of PII outside of the PHI and electronic health records. Because of the open nature and the patient first nature of healthcare, we've seen an increase in ransomware. And again, we're starting to see that creep up the vendor or the third party risk, where you may be doing everything in your realm to protect your assets under management, but you could be exposed by a third party that could then breach your data. Again, as healthcare continues to be open in a shared space, we're getting into these APIs. We're getting into these places where we're sharing data to improve patient outcomes, to improve patient service. But that data could still be vulnerable to not only your own ecosystem, but third parties in which you're sharing it. And we're going to see those things on that will affect certain business commodities like cyber insurance and what those exclusions may or may not include and what that will leave you on the hook for. Mark, over to you.
Next slide. So absolutely, third parties are a problem within an organization, because we have always proceeded with the thought process that we trust our business partners. We trust the third parties we work with. And it's not that they're attempting to do something nefarious. It really comes down to, are they taking the same risk tolerance posture as we are? Are they protecting the entire situation? So you may have seen a lot of news out there about zero trust and so forth, which is really, it's a paradigm shift to say we need to change from always trusting everything within a technology standpoint into no trust, and then you allow the things to happen you want to happen. So from that perspective, it's not a product, it's not a technology in and of itself, it's a paradigm shift to deny all and allow a few. But when we look at that, we have to consider the fact that this means things like what happened with the SolarWinds incident, I guess is probably the best way to say it, whereby a whole supply chain was breached because the software provider had been breached. And thus, we have to take into account that we only want things to happen a certain way within an environment. When that piece of software starts behaving and functioning differently, how do we catch that? How do we become part of the solution? Well, the solution really is IT service assurance. We have to make sure that we have a program in place that uses the technology with guardrails. Pass it back to you, JD.
Thank you, Mark. Next slide, please. Yeah. So, as we see, as you guys can see on the left side here, the left side of this chart here, um, now this isn't necessarily based on hard data. This is, it's a bit of a respondent and it's a survey, but they're looking at insecure medical devices at 64%, and that does make sense from a logical perspective, as that is where the bulk of healthcare data is generated from, patient data and patient service delivered. The next biggest one on the list is ransomware. That will continue to be an issue. And you're going to have to look at factoring in that on how you treat that and how you position your risk tolerance to deal with that from an ongoing basis, not just a one-off issue. Insecure mobile apps, again, as you guys distribute more data through various ecosystems, including mobile, web, shared, Kafka, backend, patient data, billing, all the fun stuff that goes on. Again, some of the apps are outside of your direct control. So you have to start treating that from the perspective of, like, how much data do we have at risk? Do we have a data map that can show us how this flow looks and what are our particular vulnerabilities or weak points? Employee negligence or error, that's, pretty consistent and commoditized at this point. It will impact the business. I just don't see it being as high as a cybersecurity incident, because it's not as media friendly and it's not as clickable for the most part. Cloud compromises, again, third party, if you're not operating the cloud, if something happens to their fabric layer or any of the services you depend on, that could impact your data and operations in a material way. BC and spoof phishing, still very prevalent, still somewhat successful, but that's starting to diminish a little bit. People are seeing limited returns on spoof phishing, and they're starting to move on to less noticeable, less noisy attacks. And supply chain risks. Me personally, I think supply chain should be a little higher up, because it's something you can't control, and it could impact significantly how you deliver services. But that's based on their purview of how they're operating their businesses. Over to you, Mark.
Next slide. So when we talk about what was being breached and what those threats were, it's really more important about response and prevention, because, like I talked about earlier, it's not a if, it's a when. So if we end up with a protection program, we have to put a foundation in place so that we can support that response. So enterprise architecture, disaster recovery, operations, security operations, all of those things have to be put into a program that then supports that response. An incident response plan should be directly mapped to a disaster recovery plan, which should be mapped to a business continuity plan. They are not all the same thing. They are owned by different parts of the organization. But when you look at what they need to do, they have to be linked. They have to understand the usage in the cloud. They have to understand where is that line of shared security responsibility in the cloud, because that is an assumption that's often made by organizations, that I'm in XYZ cloud, and they're responsible for the security of not getting breached, when in fact it depends upon how you're utilizing that cloud. You are responsible for users, you are responsible for VMs that you're setting up, virtual machines, and the like. So there is a shared responsibility, and there is a program that needs to guide what the technology does. And I think that's the real crux of the matter here, is to make sure that we put those guardrails in place, that guide in place from a programmatic standpoint, so that the technology can execute and automate that. Next slide.
Absolutely, Mark. So as a lead in from that, as we're seeing that, CISOs come across, CISOs are increasingly concerned about AI risk. It probably ranks in the 1A, 1B, 1C, 1D of their lists. And what it does, in its summary, not to get too deep into it, but if you don't have the foundational pieces that Mark was just discussing, if you don't have a good vulnerability management plan, if you don't have a good data security plan, you don't have a good business continuity plan, you don't have a good disaster recovery plan, you don't have an incident response and management plan, if you don't have a data map and understand where the data flows in your ecosystem, things that can automate, detect, respond, and patternize your specific data operations are going to have a significant advantage in the future space in which we're going to have to deal with risk and threats as they emerge. And AI being able to dynamically assign patterns to what they learn based on your digital footprint is an area of concern and an area of risk, because not everyone's going to use it to generate patient data or treat diseases or do all the great things that generally, the healthcare industry is traditionally focused on. So we just need to understand that. And then again, like any successful enterprise, any successful business, get back to foundation and make sure that we have the foundational steps underneath that to deal with it. Now, the interesting thing with geopolitical is that, are there geopolitical or nation state threats that would use AI to their advantage and take that out into the world and try to do harm? I think that's, going to be an interesting place for theses and different like that as it emerges. And, we'll have to see what happens there. But again, that will get very, very interesting. Attacks and threats, they're getting more sophisticated and less noisy. And so what I mean is that I was on a breach recently where actors got access to the network. They actually patched the servers because they did not want to draw the attention of the vulnerability management security team, because they could quietly then exfil data and over a longer time frame, gather more assets, gather more data, and create a level of success that they hadn't seen before, because they didn't make any noise. They weren't trying to rattle drums. They weren't trying to disrupt services. They actually made sure that there would be no reason to look on that box or look on that workload and see if anything had changed, or they had put a seamless agent on it to start exfilling data and encrypt that data so it was undetectable. The cloud will, as we start driving workloads to the cloud and larger shared and APIs to drive that data, data security, which is the core asset of any enterprise, especially in the digital age, which is going to drive your patient data, value for your organization, improved service times, improved patient outcomes. In my opinion, should be a little higher up, because that's going to be an underpinning for all the other things underneath it. Quantum will be what it will be. I don't have an opinion on it yet. There's only 2 quantum labs. And supply chain, again, supply chain risks always point out that you're only as strong as your weakest link. And again, that gets back to Marc's earlier point about having a strong foundation, doing your due diligence in your supply chain, making sure your dependency scans are clean, making sure that any open source licensing or anything that can be cut off that could affect availability, right? It's not just being hacked, but if you don't manage a lot of your third party in these integrated scenarios, you can have other things affect your availability and therefore patient outcomes and delivery. That's just not directly related to cyber, but an overall availability risk. So, and we'll move on to the next slide. Back over to you, Marc.
Absolutely. So I know a lot of us are thinking about this in today's environment. What about artificial intelligence? What about generative AI and so forth? And it's going to be definitely an innovator, especially within healthcare. But again, if we have a team that is putting together an action plan, a mitigation plan, we have to be singing from the same hymnal. We have to be, executing on the same game plan. And that together means that we can use the technology appropriately, but we can also protect against the misuse of that technology. And again, the program is what allows us to have the same hymnal, to have the same game plan, is that we're all on the same page in attacking the fast and generative form of computers coming after the vulnerabilities in rapid succession, right? It's not just an individual anymore. It's bots, it's generative AI that is creating the havoc and then coming after. So if we, again, have that playbook, then we can execute upon that playbook. Let's go on to the next slide. So I've been talking about it a lot, IT service assurance, and really what that is the program I'm speaking of. It's how do I make sure that I have a game plan, I have a mitigation a strategy, how do I maintain a response to a breach, how do I prevent a breach? And really, if you think about this, the development of strategy is twofold. You have the business strategy and you have the IT strategy to support it, and the execution plans to come together at the end and deliver an outcome, a goal, patient care. But that is generally expressed in the terms of demand through an application to infrastructure to facilities, and that could be your own on-premise facilities or cloud or a hybrid thereof. The only way to deliver it efficiently, effectively, and make sure that you're protecting your organization is through that game plan, that IT service assurance program, and giving everybody the opportunity to, again, understand their role in the incident, understand how to act in that incident, and then respond to that incident. And it's not something that can be done chaotically at the moment. Like a firefighter. Even firefighters have a game plan. They practice over and over and over again to control the situation in a scenario where they may not have control. But at least, again, they are going ahead and executing off the same game plan. Next slide.
So, thank you, Mark. Building on what Mark has said, and this theme between both of us, we've seen over our, many decades of practice at this point. In any of these environments, you have to have consistent security applied across your entire ecosystem. And where you're only as secure as your weakest link. And I use this when I was working with some people in Africa, and to get the point across, it's immunization is cheap, triage is expensive, right? So hopefully that makes it relatable to healthcare folks, but the more consistent you apply your security, the more you are immunized from environmental threats that could disrupt operations or pose a material risk to the business. So we tried to represent what the ecosystem looks like. We've got a mobile app, browsers, some Kafka backend for distributed data. We've got APIs where we're sharing, going across multiple application servers, whether it's on-prem or cloud, and various IoT and medical devices. And again, these are all connected within your hospital. Even an ATM could pose a risk if it's on your network in the hospital. So again, the more consistent we can apply those foundational practices, the better the outcomes we're going to have, and the less things are going to be able to affect us in a negative way. Back over to you, Mark.
Excellent. I think that opens us up for questions and discussion.
Yeah, thank you so much for presenting this. And as folks are thinking about this, I know there's a lot presented, and I just wanted to start by, by asking both of you, I think the issues you discussed today, just thinking about the ripple effects that occur, right, with these challenges. And one thing is specific coming to mind with medical devices, and you mentioned that and given the telehealth and technology and the ways that hospitals and health systems are expanding, that flexibility, right, of working with patients and also having the data security, are there, and you mentioned some of these, but just maybe to remind or hone in if I missed it, some better practices or how hospitals and those folks can work to maintain that data and security and trust, while also allowing for those visits and the information to be shared, over the lines.
I'll go ahead and take a first swag at that, and then JD, I'll throw it over to you. So the core element is we don't want information to leak out of the organization, right? So that the core element, it is not only we are trying to prevent by putting the systems in place to not allow bad actors in, but we have to protect that information. And I say that from a little bit of a background that I'll get up on a soapbox briefly and say that data, bits and bytes and types of files are not the important pieces. It's how you link and organize those into information that's valuable to the organization, whether, like JD said earlier, PII, personal identifiable information, or health records, et cetera. So we need to make sure that we can identify all throughout the organization, not just within our EHR, We have to identify where that information lives and protect the information based upon its classification and criticality. JD?
Yeah, and I would say, to just take it one level down, is that you have to have a good working knowledge and a good understanding of where your data flows in your organization. How many touch points are there? Where is it shared? Are your APIs documented in your data asset list? Are they documented in your recovery plan? These are the things that you've got assets, you're managing data. How are they documented, and are they recoverable? These are the things that we tend to overlook. And I think where healthcare organizations can focus on their core mission, which is delivering world-class healthcare services to patients and the people that need it, is you're never going to scale up a full enterprise security team. What you need to do is look for ways that you can quickly understand your landscape, quickly understand your ecosystem, and figure out how to automate and embed a lot of your application data and operational behaviors in your day-to-day activities, and not just make it a one-time, once a year security awareness training that you check the box. Because the interesting thing in our space is that you can be compliant, that doesn't necessarily mean you're secure. So that's where I would say, foundational things are the most important. That's, those are the things that lead to success, and they lead to better outcomes for everybody involved. And as you're in a partner network, you're sharing data. Is you need to sit down with your partners and say, hey, this is our risk profile or our risk tolerance. What's yours? Are they aligned? Let's do a 30-minute call. If you're dealing with a downstream hospital or data analysis, or that's like, hey guys, we're sharing data from our hospital, our patient data, sometimes payment data, address data, vital statistics, all the good stuff that comes with your environment. You can just start having those conversations and say, hey guys, this is our risk profile. We're taking our data and our security. We see this as a core asset to our business. We just want to understand, are we aligned? And if we're not, how can we start working together to improve and remove a lot of the things that could hurt us reputationally and become material impacts to both our businesses? We don't want to solve problems through lawyers when we can solve them through communication and technology.
Yeah, thank you. And we have one more question for before we close out this afternoon. And it was, why is health data and HER so valuable and often targeted by hackers?
Mark, do you mind if I start on that one, and you can?
Please do.
All right. So you guys are in the fortunate or unfortunate position be in the healthcare space. You guys not only have PII, you have vital statistics, you have addresses, you have sometimes blood work, credit cards, payment info, benefits IDs, for people that are getting services delivered through insurance or through a healthcare benefit through work, sometimes employee IDs. Everyone, when there's a breach, people focus on like credit cards or, these guys got hacked in finance because they have a big profile, and, that's, the commercial space tends to suck up a lot of the attention. But, one of the biggest areas of fraud is healthcare organizations delivering services to people who are fraudulently using them. That's time, money, and professional service and professionals that you can't get back from doctors, nurses, lab techs running those tests, and then there's no way to collect on that. And it's not talked about that much, but it's extremely valuable, and it's and extremely impactful to how we deliver services in the modern era. And again, getting back to those foundational pieces, the better we understand it, the better we understand our people, the better we understand our patient profile, the more vigilant we can become. We embed that into our activities. We're not doing a security awareness on it and then producing a fraud report. Like, again, I want to solve it. My goal is to always solve it through automation, always solve it through technology or process adaptation, and not make the papers and not have to solve it through lawyers and litigation.
Yeah, I would expand on that just to say that healthcare information provides information about an individual, which becomes the basis for other hacks, that becomes the basis for breaking into email accounts that are personal, that then you can transverse into an enterprise through a smart device, right? It's the element of being able to say, okay, like JD said, we've got your payment information. Now we can get into XYZ bank because we have your credentials. We've been able to social engineer from that information. So it's not simply just ransom that they're getting from a hospital or a healthcare system. It is much more prevalent to then take that and use it elsewhere to gain more value, more money.
Yeah, well, thank you. Yes, and we've come up on time for the webinar for this afternoon, but I do want to again thank both of you, Marc and JD, for sharing your time with us and this information. And I know it's really timely. It was always timely, but especially now, as you mentioned, with everything that's going on. So we really appreciate your time and information. And for those, just a reminder, we will share this recording and information out afterwards too. And for those attending today, thank you for joining us. We do have some upcoming events with our webinars coming up later this week and next week, additional webinars and some in-person events. And so, if you have interest in looking at the upcoming ones, please take a look at this QR code and see all that we have to offer. So again, thank you both very much. And thank you all for attending today, and have a wonderful afternoon.